Colonoscopy allows doctors to view the inside of your colon. During a colonoscopy examination, a narrow, flexible tube called an endoscope will be introduced into your colon via the anus. The endoscope contains a miniature camera and a light source at its tip. This specialized equipment will allow doctors and nurses to gain a clear view of the inside of your bowel. The endoscope includes so-called working channels, which allow doctors to use tiny instruments during the examination. These instruments can be used, for example, to obtain biopsies and to remove polyps. Colonoscopy is the best technique for diagnosing and preventing colorectal cancer. It is also very useful for diagnosing and monitoring many other diseases, such as inflammatory bowel disease, IBD, and chronic diarrhea. Complications are rare. When polyps have been removed, some bleeding may occur in 1 to 6% of cases, and it almost always rectifies itself. Colonoscopy is currently the only examination available whereby polyps, even flat or very small ones, can be found and removed during the same procedure. If you've never had a colonoscopy before, it's natural to have questions about the procedure. This video aims to address the most frequently asked questions so that you will know what to expect when you go for your colonoscopy examination. A clean bowel is necessary to facilitate a thorough examination of the colon. Therefore, preparation is key. Before your examination, your doctor will provide you with special medication, either in liquid, powder, or tablet form. Consuming the prescribed medication in adherence to the instructions of your physician will help to ensure that the intestine is completely clean. Poor bowel preparation may mean that polyps or cancerous lesions are hidden. It also means that the procedure may need to be repeated if the doctor cannot adequately view all aspects of your colon. At the end of the preparation phase, the water that you eliminate when opening your bowel should be as clear as water. There is the reputation that some bowel preparation solutions may have an unpleasant taste. However, new options are greatly improved and often have a more palatable citrus flavor. Additionally, these new bowel preparation medications do not need to be consumed at a very high volume, which was often the case previously. Rest assured, your healthcare provider will choose the most appropriate preparation plan for you. During your first doctor's visit, the medical staff will provide you with a prescription for a bowel preparation medication, in addition to information regarding the examination itself. The preparation phase is perhaps the most inconvenient part of the procedure for patients. You will need to consume a specified amount of liquid at specific times and stick to a diet as outlined by your healthcare provider. Do not eat or drink anything 2 hours before the examination. If you have any specific questions about your bowel preparation regime, be sure to speak to your physician during your preparatory consultation. In addition to the bowel preparation medication which you will need to take, you may be asked to follow a strict residue-free diet before the examination. This will help to make sure that the right side and most importantly the lower section of your colon is perfectly clean. Before meeting with your healthcare provider, it is very useful to prepare a complete list of the medications along with the doses which you usually or are currently taking. It is important to stress that your normal medication regime should only be changed under the guidance of your healthcare provider. They will be able to assess your specific situation and update your medication plan accordingly. Please do not make any decisions on your own in this regard. Prior to the examination, you will be provided with a gown and shown to a private space where you will be able to change your clothes. You will then be asked to lie on a bed, either on your back or on your side. During the examination, your vital signs, such as heart rate, will be monitored. An anesthetic may be administered to make you feel more comfortable and relaxed. If anesthesia is to be used, then the medical staff will insert an intravenous catheter into your hand or arm, which will allow them to administer the anesthetic. New disinfectants, automatic endoscope washing machines and single-use devices have significantly reduced the risk of contamination. During the procedure, the medical staff will introduce the endoscope into the bowel via the anus. The endoscope will be inserted until the tip reaches the section of the colon called the cecum. This is where the small bowel connects with the colon. To advance the endoscope into the bowel, it is necessary to add some air or carbon dioxide into the colon. The addition of gas may make you feel some pressure in your abdomen. If it becomes uncomfortable or painful, let your doctor know. Once the endoscope reaches the end of the colon, your doctor will start to slowly withdraw the endoscope. While doing so, they will be closely examining the walls of the colon, looking for any abnormalities. A bluish dye may be sprayed from the tip of the endoscope in order to make it easier to see flat polyps. Tissue samples can also be collected during a colonoscopy. This is not painful and will help determine the nature of any lesions found. If small polyps are found, then a thin wire snare may be used to lasso and remove them. Similar to the material removed during biopsy, polyps will be sent to the laboratory for microscopic evaluation. After the examination has been completed, you will be taken to a recovery room where you can rest and recover from the sedative or anesthetic. Sometimes you will need to eliminate the excess air which was introduced into your bowel. This is totally normal. The medical staff will inform you when you can start eating. Usually this is possible within 20 minutes after the procedure. After the colonoscopy, you will be given a full report of the examination, possibly with photos and instructions for resuming any medication that you may have stopped taking. Your report should contain photos and text. In the text, it should specify the quality of your bowel preparation, the completeness of the procedure, and a description of the lesions found. If a polyp was found, you may need a further surveillance colonoscopy. This may be included in your report. Otherwise, your doctor will advise you once they have the report about the nature of the lesions found. In the case where you notice blood in your bowel movements persistently on several occasions after your procedure, you should contact your doctor. At this point, you will now be able to go home, accompanied by another person. If you received sedation during the colonoscopy, driving is the only activity which is prohibited immediately after the examination. It is best if you can plan to take the rest of the day off after your colonoscopy. We hope that you have found this video informative and helpful. Remember, if you have any specific questions regarding your colonoscopy, be sure to speak to your healthcare provider.